Assessing research. This video will discuss the research methods used in assessing the quality and value of the research, hopefully leading to insights that are valid and reliable. To begin with, critical appraisals are when individuals evaluate the evidence of claims, since it is necessary for members of the general community to have a critical mind in assessing the claims, arguments, insights, values, and beliefs, which is used by psychologists to conduct research. Psychological research has been permeated by the reproducibility crisis, since some studies were unable to be replicated. It is hoped that in following ethical practices, the research can become replicated. This problem had largely stemmed from academics only publishing significant results, ignoring and not paying statisticians when non-significance is present. Thus, in the light of the crisis, we must continue to pursue ethical research for science to progress and real breakthroughs to occur. Research designs are studied to solve any methodological problems, to maximize efficiency of resources and minimize the potential for ambiguous interpretation and biases. Critical appraisals are key to this since they allow us to evaluate whether the results, hypotheses, and conclusions are accurate and reflect our understanding of reality. To be critical is not necessarily to be negative, but rather to have a balanced assessment of the researcher's strengths and limitations. One must assess the processes and the results of the research by considering the researcher's aims, methods, conclusions, and implications. It is significant for individuals to construct research and past findings, finding gaps in the literature that help to increase the scope of knowledge about the problem. Thus, critical appraisals are a necessary component in psychological empirical research. To reiterate, the scientific method relies on conclusions based on reproducible and quantifiable evidence. We must consider threats to internal validity, such as the results due to what authors think, or are there any other alternative explanations. We must consider threats to external validity, in which can the results be generalized beyond the sample. Other aspects of research to consider include, firstly, the clarity of the research question, where one should assess the quality of sampling and/or measurement in whether it is appropriate to the population and the constructs. Secondly, one must assess the quality of the experimental design, such as if the design is appropriate for the research question. Does it mix up correlation with causation language? How well does it maximize power and minimize biases? How large is the sample size? Does it use the appropriate statistical analyses and interpretations? There are formal assessment tools and a large variety of guidelines to use. The researcher's quality could be assessed via the Critical Appraisal Skills Guidelines, or CASP. CASP firstly considers whether the results are valid by asking questions such as if the trial addresses a clearly focused issue, whether patients randomly assigned, whether conclusions accurate, whether studies blind for patients, as well as study personnel, and were groups treated equally other than in the experimental intervention. CASP also considers what the results were, how large and precise was the treatment effect. Finally, CASP looks at whether the results can help locally, its implications for the local population, context, and any other clinical outcomes. Thus, CASP is quite effective in asking questions that can help analyze the quality of the research. You can also assess the quality of a research via CONSORT, which assigns a score to each appraisal criteria, allowing for articles to be compared by summing up the scores. Additionally, biases in appraisal guidelines tend to be used for intervention studies. Less attention is given to other forms of research, which can still be an obvious problem. To address biases, one must consider if the study has substantive biases that may invalidate findings. Does the study apply to you? What are the results and implications? Also in experimentation, please consider the clarity of aims, if they are clear, and what can be inferred when going forth towards the discussion. Was random allocation used? Were subjects accounted for? Was there blinding implemented, and were baseline groups used? As in, was there control? Is there equal treatment? Were there confounds, and how were they dealt with? Were the results precise? Are there confidence intervals? Were the standard deviations small? And was Cohen's D reported? Also consider the application and implication of these results in a specific context, whether they were effective. You can also assess the journal quality in how they deal with biases, questions of which I've proposed before. The impact factor, or the number of citations that use the specific research, can measure the quality and impact of the research on different sources, but sometimes the IF could be misleading since a higher IF article tends to be cited more, creating a perpetual inequality between journal articles, leaving some in the limelight and others, well, overshadowed by the big banana. Thus, it is important to use critical appraisals to address and assess research and to ensure ethical practice. We looked at various criteria such as CASP and CONSORT, as well as ways to address the problem of biases in the research. And we also looked at impact factors. Thanks for watching.